Dr. Amesh Adalja joins us now. Doctor, thanks for joining us here on News Nation.
Thanks for having me.
So as we talk about the NCAA tournament, what do you know about the protocols in place to protect these teams?
It's a pretty extensive protocol, and it ranges from having the games all really played in Indianapolis to restrictions on fans to creating kind of a quasi bubble where certain players are not able to really interact with anybody outside of their hotels and their other teammates. They have to have 7 days of negative tests. So it is pretty extensive, but again, it's not completely ironclad, especially in a situation where we have tens of thousands of cases occurring every day. It's not the exact same thing that the NBA did or the NHL did, but it's pretty close.
So 68 teams comprise this tournament. Some have since gone out. We're down to roughly 32 teams going into today. What was the likelihood that a team, we're talking about Virginia Commonwealth here, but what was the likelihood that a team was going to have negative tests for days leading up to this and then suddenly have positive tests?
I was someone that thought for sure we were going to have some cases, and indeed cases have occurred in other teams. It's a little bit extraordinary to have a cluster with one university where they don't actually know how people got infected. It's multiple cases over multiple days. And I think that really errs on the side of canceling that team's performances in this tournament because they don't know how those people got infected. They weren't able to roster 5 people. So there clearly is something that's happened with the VCU team. And I think it's going to take some time to understand it. And hopefully it hasn't spread to other teams.
Is the only answer when we're talking about positive tests of the coronavirus to cancel games in an event like this? Was the only way to do this to pull VCU from the tournament?
I do think the NCAA was kind of stuck because it wasn't just a single case. This was multiple cases over more than one day, and there's no indication of how these people got infected. So I do think you don't want your tournament to completely be engulfed by an outbreak from one team. So I do think that it was the right decision to make it. It was consistent with the rules that they had put forward, and unfortunately, it happened to a college team. But this is something that we had to plan for and we had to expect when you're trying to conduct a sports tournament in the middle of a pandemic.
All right, so contact tracing, it's been a hot button word for about 12 months now, but it seems to me, an outsider, not a medical professional, that contact tracing for this event, when we now have one team that has had to be pulled out, is vital.
Yes, contact tracing is vital in all situations, but it's especially going to be important in this tournament because you want to see where did these cases come from, where did they go? And the NCAA is using technology. People are wearing these sort of domino-sized electronic devices that keep track of their contacts so they can easily pull that data, which makes it a lot easier to do. So hopefully they'll be able to know where these cases originated from, where they went, and be able to minimize the impact that these cases have on people's health and on the tournament's longevity.
As we wrap up the first week of the tournament, we will go into next week for the second week. Do you think we're in good shape to get this thing finished by April 4th or 5th, I believe, is the championship date, with family and fans in the stands and what we know that's happening in Indianapolis?
I do think it's in the realm of possibility. We still have to be prepared for more cases to occur, and some of the ramifications of what happened with Virginia Commonwealth might impact other teams because, like I said earlier, we don't know how these individuals got infected. I do think this can happen. The NCAA has spent a lot of time putting together protocols and a system in order to be able to minimize the impact of the virus. So I think that this can be done, but we have to make sure that they're following the science and following their own protocols to minimize the harm that this virus causes to their tournament and to their players and fans.
Dr. Amesh Adalja, thank you for taking the time on News Nation.
Thank you for having me.
And the second round continues tomorrow with another slate of 8 games.